If you floss and your gums bleed, your body is giving you a hint. If your hand bleeds, you don't take it as normal. Wisdom teeth are interesting critters. Not everybody has all of them. They're being phased out by something called evolution. And I run across a couple of people a year who have none. Oftentimes you'll have one missing, maybe two. Most people have four. Whether they need to be extracted is a clinical judgment, okay? Some people do, some people don't. If the teeth make it all the way in and are useful, they're actually biting against the opposing tooth, and you can keep them clean, awesome. You got dad's mouth and mom's teeth and everything fits. But if you get dad's teeth in mom's mouth, they don't fit. And that's more often the case. And so if you've got a tooth that's way out of the picture, isn't even close to coming in and isn't pushing everything around, then they may well be able to just sit around and hide away. But especially if they're partway in and partway out, the bacteria can get around there and you can't get there to clean them, then that's a problem. And better to get them addressed when you're younger and you bounce. Get it over with, move on. You know, to have a couple taken away out and then come back and get them done, move on with your life. Sugar and dentists don't necessarily get along great, okay? Basically, the sugar doesn't cause a cavity, okay? If you sit sugar on a tooth, it can sit there for 20 centuries, nothing's happening. However, it's not that simple in your mouth. You've got these things called bacteria, and they do love sugars. We call them, for the kids, I call them sugar bugs. And the sugar bugs go in and they eat the sugar. And they basically put acid out the other end, okay? And that acid sitting on your gums, on your teeth, causes problems. Acid is not good for you, okay? When it's sitting on the tooth, it actually depletes the minerals. It dissolves them out and you're left with something that's no longer hard. You're left with something that's soft, and that's what a cavity is. If you let it sit on the gum tissue, it's very irritating. It turns it red and puffy and it bleeds more easily. So yeah, sugar is not your friend. Fine, you can eat it, but brush afterwards. Eat it with meals, buffer it. So I'm not somebody who says you cannot have sugar in your life, but you need to do it on a controlled basis and make sure you clean up afterwards and don't allow it to run rampant in there. Brushing harder doesn't get plaque off better. Plaque is soft. It's kind of like, maybe I'm getting a little old here, cream of wheat. If you don't know what that is, look it up on the internet. Okay, it's that sticky, soft stuff. It's on there, it's sticky. It doesn't take a lot of force to get it off of there, but you need to get into all the nooks and crannies. So a lot of people figure brush real hard or use a really stiff brush to help get it, off of it. No, you want to use a soft bristle brush and get into all the nooks and crannies as well as you can, okay? You want to use floss, water pick, things like that as an adjunct to it to get in between, but basically brushing harder is not helping. Getting everywhere with a soft bristle brush, or as many places as you can with a brush, that's the priority. And doing it consistently so that you keep breaking it up. It rebuilds every 24 hours. You gotta be getting it off at least once, maybe multiple times in that time frame. If you floss and your gums bleed, your body is giving you a hint. If your hand bleeds, you don't take it as normal, okay? If a piece of string causes your gums to bleed, that's not normal, okay? That means that gum tissue is puffy, swollen, irritated. It's not healthy, okay? What you want to do is stir it up, get it clean, get it healthy, go see your dentist, go see your hygienist, get caught up. There's some things, when plaque turns into calculus, when it turns into the hard stuff, you're not going to get that off with a brush or a piece of string. You need some help. Once you've got that help and you've gotten those particles and plaque and all off of there, then when you go in with the floss and the brush, then you can get it healthy. If you're bleeding from a simple piece of string, there's a problem. Address it. Teeth aren't always predictable. You'd like to think they are. They live by one set of rules and you can judge by that. They don't. I've seen teeth that are driving people absolutely crazy that appear to be fine. No cavities, no nothing. I've seen teeth that are off at the gum line that aren't even bothering anybody, that are decayed right off the whole top of them. It's not that predictable. If you've got decay, yes, you want to get it addressed before it gets into the nerve, because once it gets into that center of the tooth, then you're likely to feel pain. And you want to catch it well before it gets to that point. But just because a tooth hurts doesn't mean that's a cavity causing it. Oftentimes, especially in times of pandemics and little things like that, people are gritting their teeth, they're grinding their teeth, they're really gnashing down and trying to drive those teeth right down into the sockets. And they don't appreciate that. You can actually bruise a tooth that way. And by just jamming it down into the socket, if you do it enough, you can actually cause, long-lasting damage. But in this day and age, you need to get it checked to find out what is causing that. Don't assume it's a cavity, but also don't assume it's not a cavity. Get it checked, figure out what's going on, get it addressed.